Well, good morning, everyone. I'm Brad Butt, the Vice President of Government and Stakeholder Relations at the Mississauga Board of Trade, and it's our great pleasure to have all of you join us today. Well over 100 confirmed business people throughout the region of Peel joining us today, and we're just thrilled that we could put on this extremely timely webinar for your benefit, keeping COVID-19 out of the workplace, preventing and mitigating outbreaks. As an employer in the region of Peel, you will be joined today by the City of Brampton, the Town of Caledon, City of Mississauga, and the Ministry of Labour, Training and Skills Development in this webinar that is presented by our friends at Peel Public Health and hosted by us here at the Mississauga Board of Trade. During this webinar, you will learn what is changed in managing workplace outbreaks, a refresher on best practices and expectations, real-life tips from an inspector on how to prevent cases in the workplace. So today's webinar is presented in partnership by the regional partners of the City of Brampton and the Town of Caledon, along with the City of Mississauga. We thank you for this collaborative opportunity to deliver a shared message together with Peel Public Health to our regional workforce. Before we get started, I'd like to quickly review the virtual event protocols for this morning. All attendees are going to remain on mute as we are recording this event. There will be a question and answer session that will occur after our speakers have made their presentations. And if you do have a question, we encourage you to submit that through the Q&A button, which is at the bottom middle of your screen, and enter the question. Those questions are only visible to us at the Mississauga Board of Trade, as well as our panelists. We'll sift through as many of the questions as we can that are on topic of what the issues are that we're discussing this morning, and we'll try and get as many of those answered as we can in the hour that we have ahead of us. So now I'd like to introduce our various speakers and presenters for today. Louise Aubin is the Director of Health Promotion, Peel Region Public Health. During the COVID response, Louise has been the lead for enforcement of the Reopening Ontario Act regulations, as well as overseeing critical non-COVID public health functions. We also have Hira Morano. She's the acting supervisor of the Outbreaks Team Operations, Peel Region Public Health. Prior to the COVID-19 response, Hira has had many years of experience in the Communicable Diseases Program as a public health nurse, and also worked as an infection control specialist. She is one of the first case managers brought in to the COVID response, and is currently a supervisor for the Outbreaks team, which manages outbreaks in workplaces. And we have James Fung. He's an infection control specialist at Peel Region Public Health. Prior to COVID-19, James has worked with Peel Public Health and the City of Hamilton oral health programs with a focus on infection control. During the pandemic, he has performed on-site visits and consultations specific to COVID-19 prevention. Across the region of Peel, he worked directly with various workplaces, including manufacturing, logistics, transport, retail, and emergency services. So please join me in welcoming Louise, and then Hira and James.
So thank you very much for the opportunity to speak to you today, and thank you to MBOT for organizing this event. We all know that getting COVID-19 vaccine is on everybody's mind right now, including when your employees will be eligible to receive the vaccine. Peel's community mass vaccination plan is guided by Ontario's 3-phase vaccination plan that prioritizes vaccines for those who are at greatest risk of severe illness, as illustrated by the image on the slide. Currently, Workers who cannot work from home in certain sectors are included in phase 2 of Ontario's plan. Vaccine supply is ramping up, and we continue to focus our efforts on high-risk healthcare workers and Peel residents who are at the highest risk of severe outcomes from COVID-19. The virus continues to circulate at high rates in our community, and battling workplace outbreaks will continue to be both a challenge and a priority. The webinar content today will focus exclusively on steps that you can take to protect your employees from COVID-19 and how to respond in the event of an outbreak while we bridge the gap to broader vaccination coverage. Next slide, please. So with respect to COVID-19, the Region of Peel Public Health can issue orders under Section 22 of the Health Protection and Promotion Act. The goal of these orders is to put measures in place to prevent or slow the transmission of COVID in the community and within workplaces. These orders are posted on our website, and there is an order that requires individuals to self-isolate, and another, which will be the focus of our presentation today, is for workplaces. These are legal tools, and non-compliance can result in both fines for individuals and for corporations. Next slide. So under the order, anyone who has been diagnosed with COVID-19, has signs and symptoms of COVID-19, been tested and are awaiting their results, otherwise have reasonable grounds to believe that they have symptoms of COVID-19, or is a close contact of a person diagnosed with or has symptoms of COVID-19 must be sent home from work. The definition of a close contact includes those who have had face-to-face contact with a COVID-19 case while they were infectious, and this generally means 48 hours before the case's symptoms started until they are cleared from their isolation, and has had 15 minutes or more of cumulative interaction within 2 meters of the case, regardless of whether the case or the contact were wearing a mask. A close contact can also be identified by Peel Public Health or another public health unit as a close contact of a probable or confirmed case. And in certain workplace settings, for example, healthcare setting, there may be additional factors that are considered to determine whether an individual is considered a close contact. For example, the use of recommended personal protective equipment. Next slide. So within the Class 22 order, there are certain measures that that have to be followed, and these include the measures outlined in Ontario regulations, so under the Reopening Ontario Act, as well as the advice of the Chief Medical Officer of Health, and sector-specific guidances related to things like screening, physical distancing, limiting non-essential visitors, and so on. The sector-specific guidance documents are available on the provincial website, and there are also resources available on other websites like the WSIB website. With respect to these orders, all provincial offences officers, including police, bylaw officers, and provincial inspectors, have been given authority to issue tickets and summons for non-compliance. Offences can include not complying with the Class 22 workplace order, not self-isolating, and so on. Next slide, please. So with respect to cases in the workplace, for one confirmed positive case in your workplace, that individual should be sent home to self-isolate, and you should review and follow your workplace safety plan. You do not need to report one case to public health. Public health will contact the case independently and help them identify their close contacts, including any that might be in the workplace. Those who have tested positive are provided information they can share with their close contacts. If there are 2 or more cases in your workplace, there are a number of requirements, including those that are listed on the slide, including notifying Peel Public Health, the Ministry of Labour, Training and Skills Development, WSIB, and in the case of a federal workplace like the airport or let's say a food processing plant where the Canadian Food Inspection Agency wouldn't be involved, you should notify your federal counterparts as well. Peel Public Health will be looking for a list of close contacts, a contact person who should be available to work with the health department, And James will talk further in a few moments about what an IPAC inspection, an infection prevention and control inspection would entail. So with that, I'll hand it over to Hyra now to continue. Thank you.
Thanks, Louise. Good morning, everyone. I'm sure a lot of you have joined the webinar today because you're wondering what happens if my workplace has an outbreak. So my goal is to hopefully walk you through what an outbreak may look like at your workplace and also to highlight some of those principles with outbreak management. Next slide, please. So it's important for us to first off recognize the teamwork involved with outbreak management. There's many players involved with different roles to play. And ultimately, we all have the same goal of ensuring that there is control and stopping the outbreak. So in the next couple of slides, we are going to go over some of those different key players and what their roles and responsibilities are. Next slide, please. So the roles and the responsibilities of the employer may include the general duty to protect their workers. And if they are operating, have a written safety plan. They should also be providing notices of an occupational illness to the Ministry of Labor. And in order to support contact tracing, maintaining an accurate shift record and up-to-date contact information for their employees. As well, they should also be communicating with their staff and relevant stakeholders when there is an outbreak. And the employees themselves also have a role to play, such as not coming to work if they feel unwell and following those control measures. Next slide, please. The roles and responsibilities of the Ministry of Labor include receiving notice of an occupational illness under the Ontario Health and Safety Act, investigating notifications of these occupational illnesses, proactively inspecting workplaces to monitor compliance, and also issuing orders under the OHSA as needed. Next slide. The roles and responsibilities of public health would be to investigate cases and clusters of COVID-19 at workplace locations, determining if an outbreak exists, and if so, providing recommendations on outbreak measures, providing ongoing support to the workplace until we can determine the outbreak can be declared over. And usually public health gets involved in two ways. The first way is if we receive reports from the workplace reporting that there may be 2 or 3 of their staff who tested positive for COVID, or if using the provincial surveillance system, public health gets notified of a cluster of cases that is associated with the same location. And when that happens, that is when public health starts their investigation. And how do we know what is an outbreak? Next slide, please. We have an outbreak definition. So according to the Ministry of Health, an outbreak in a workplace setting is defined as 2 or more lab-confirmed COVID-19 cases with an epidemiological link in the workplace within a 14-day period where the cases could have reasonably acquired the infection in the workplace. So I understand this definition, unfortunately, is quite wordy and is quite lengthy. So I'll try to break it down. Basically, you need at least 2 cases who are lab confirmed for COVID. And this word epidemiological link, in short, EpiLink, is basically talking about what these 2 cases have in common that would have explained why they got it from each other. And this EpiLink should be attributed to the workplace. So for instance, if they happen to work in the same area or the same shift, and these 2 cases would appear within 14 days of each other, because that is the incubation period for COVID. So in terms of the other common exposures that happen outside of the workplace, for instance, if you have 2 cases and they happen to carpool and work together, or they live together and also work together, that is an EpiLink, but it's not solely attributable to the workplace itself. So when we say somebody could have reasonably acquired it at the workplace, we are technically saying we have a known exposure in the workplace, or there's no obvious source of infection that occurred outside of the workplace. So hopefully that is a bit more clear for you. So 2 or more lab confirmed COVID cases, EpiLink to each other, working at the workplace within 14 days, and they have acquired the infection potentially at the workplace and not outside. Next slide, please. So finally, when an outbreak is identified, control measures must be taken, and we will work with you to help control the outbreak by identifying those at risk, provide recommendations on testing, assessing the infection prevention and control measures, facilitate on-site inspections if needed, and also determining if there is a need for workplace restrictions or even possibly closures. Next slide, please. So the very first step when it comes to outbreak management is risk assessment. Usually this risk assessment happens when we start our investigation. We try our best to get as much information from you as possible. So we may be asking you questions on the phone, such as who may have been in close contact with that positive employee. Can you tell us how the staff at the workplace move around the workplace? Are they mostly stationary or are they floating around? Can you describe how your facility looks like? What's the physical layout, common areas they would share? Just basically getting an understanding of your facility, your operations, because that will help us identify as well which employees would be a close contact. So those are the ones at highest risk of developing COVID, and also helping to determine where are those opportunities for transmission or spread that could have occurred. Next slide, please. So after we do our risk assessment, we will also make recommendations on who to test and when to test. Who to test are those close contacts or at risk for developing COVID, but when to test is also important. So for instance, if somebody gets exposed to COVID, it does take a bit of time for the virus to incubate or to grow inside our body. And sometimes if you do it too soon, it doesn't have enough time for it to become detectable on a swab. So that's why public health will also recommend when's the best time for your staff to actually get tested, so we are getting the most accurate results. And once we identify these staff, we will also provide you with an outbreak identification number. This number is quite unique. It is unique only to your workplace and only to your outbreak. And it is very helpful when we are asking people to get tested. Basically, this number, we use it to identify and track those results, because once those results get into the surveillance system with the labs, we can actually find them and say this result belongs to this workplace, to this outbreak, so we can actually have an accurate case count. Next slide, please. When it comes to infection prevention and control, we will review those measures with you that is currently in place at your workplace. Sometimes these are basically referring to things such as signage, screening, what are your physical distancing measures or policies. And then if we are able to identify any gaps or measures that maybe need some enhancing, then we'll provide it as needed, and also making sure that there is adherence to these measures. Next slide, please. An on-site IPAC inspection is not usually done with every outbreak, but it is a very helpful tool, helpful strategy. So basically this on-site inspection, we usually do it in cases where the outbreak itself is, we're not able to truly see the risks. Sometimes there's many cases in the facility and we're not sure how they're all linked together, or the measures are in place, yet we still continue to see a rise in the cases. So having somebody go on site and be the eyes there to actually see firsthand what's happening on the ground is very, very helpful. And sometimes this on-site attendance will be done by public health alone, but sometimes we will also coordinate it with other agencies. So sort of like a joint visit. Other agencies could include the Ministry of Labor, for instance. And the goal of this IPAC visit is really to assess those other risks that could be contributing to the outbreak that we may not really see since it's not on site that we're there. Next slide, please. So this is actually a popular question we get a lot. When would a workplace close? So normally the only time we would really close a workplace is usually if the outbreak is not controlled, or if there is an outbreak and you have implemented those measures. Sometimes they're not able to actually be implemented in some cases. So we may ask you to temporarily close until those measures could be in place. But in most often our outbreaks, those closures are done voluntarily by the workplace. Sometimes the workplace will say, this line, there's mostly cases and close contacts, and everyone unfortunately had to be isolated and they could not function with that line. So the operations had to stop because there was a significant impact to their workforce. So that's one example of voluntarily closing down. Our workplace has also closed down before because they wanted the entire facility to be cleaned and disinfected. So again, that was done by their choice. So in these situations, it really is under rare circumstances, we would ask a workplace to close down. Next slide, please. And then when it comes to communication or public disclosure, declaring an outbreak does not necessitate public reporting or communication of the outbreak. Unless there truly is a significant risk to the public or those outside the workplace, that's when we may have to determine if public disclosure is needed. And in some extenuating circumstances, the lack of cooperation with the investigation and failure to put measures in place may also result in this public disclosure. But this type of discussion, it happens very in depth, and it happens on a much higher level that will involve our medical officer of health. Next slide, please. So during the duration of the outbreak, we will monitor for any new cases. And if 14 days have passed and we see no new cases at your workplace, then the outbreak may be declared over. And again, that 14 days is in reference to the incubation period for COVID. Sometimes though, some outbreaks may be declared over past the 14 days, but it just depends on the nature of the outbreak. Next slide, please. And something I just wanted to mention here that is quite important are something that is called variants of concern, or VOC. Variants are viruses that have changed or mutated, and these are quite common with coronaviruses like COVID-19. However, a variant only becomes a VOC when the changes it goes through has a clinical or public health significance. And currently we have 3 new variants of COVID-19 that are creating this concern. So these 3 variants, unfortunately, spread more easily and more quickly among people, which causes even more infections with COVID. So workplaces and the community themselves, we have to be more vigilant as the variants of COVID continue to appear in our community and continue to rise. And how does this affect your outbreak? Because there may be a variant of concern in the community or in your workplace, we are going to be a little bit more stringent or strict with our measures. Sometimes we may ask people, a wider cohort, for instance, to get tested, not just the close contacts, and perhaps more strict measures regarding personal protective equipment. Next slide, please. So lastly, I just want to go over an example of what an outbreak may look like using an actual workplace outbreak that we've dealt with in the past. And hopefully this will help tie in all those principles I've mentioned with outbreak management. So to start off, this workplace had a total of 80 staff. When we were notified on March 4th, there were 3 positive cases at the time. With discussion with the cases as well as the employer, we found out that the 2 cases worked in the production line while one of them worked in distribution. In further discussions, we found out that they are actually all from the same shift and utilize the same lunchroom. The last day the case worked while they were infectious and able to spread it to others would have been March 1st. So when we had the first contact with the workplace, the risk assessment yielded 5 close contacts because we found out some of these people were not wearing their mask consistently while they were within that 2-meter distance with each other. When it comes to testing, we did provide an outbreak identification number so the close contacts can get tested using that number. When we reviewed their IPAC measures, we were able to identify some gaps and made some recommendations regarding their break times. So at that time, people were going to break at the same time, which meant that everyone was using the same lunchroom. So we did recommend to have staggered break times, having a limited capacity of people in the lunchroom. So it was at the time about 20 people and it went down to 6. That would allow even one person to sit at a table without having to share. Next slide, please. So a couple of days later, March 7th, we were actually notified of 4 new cases, unfortunately still in the production line. So now we have 6 out of the 20 employees in the production line positive. Because of this, we adjusted our testing recommendations to say the entire line should benefit from testing. The IPAC measures were successfully implemented by the workplace, but because we are continuing to see cases, we did facilitate an IPAC inspection on site. So public health, one of our inspectors visited, and they were able to highlight a few more recommendations. As a result, the recommendations included having more visible signs at the workplace. So some of the instructions, for instance, the capacity of the room was done in a memo, so it was not as visible as a sign. They also recommended to have more lockers created so that there's more space and less crowding in the locker room. Closure was not advised at the time, so the facility was able to operate without any closure or restrictions, and public disclosure was not advisable. Fast forward to March 24th, we had a total of 10 cases, and those 3 cases were actually asymptomatic at the time, but they were found because they were asked to be tested as part of the production line. The last day that the case worked while infectious was March 10th. So fortunately, there's been 14 days with no new cases, and we were able to declare the outbreak over. So hopefully that helped you guys kind of understand and go through what an outbreak normally would look like. And hopefully James can also go into detail about what an IPAC inspection would also look like on the spot. Thank you.
So thank you very much, Ira, and good morning, everyone. So I'm here to share with you some of the lessons learned from the many industries we had the opportunity to go out and see. So let's start with the 5 W's here. Can I get the next slide? Thanks. So one of the first contacts the workplace could have with Peel Public Health could be a Peel Public Health case manager in outbreak. An extension of that team would be a public health inspector or someone from infection control infection control. As mentioned earlier, it could also be a joint visit with a member or representatives from the Ministry of Labor. And what this visit is here to do is really to make sure it's a collaborative effort between the workplace and Peel Public Health. And what we bring is the high level guidances from Health Canada, from Public Health Ontario, and we unpack it there at the work site to make sure that they are interpreted in the right way. We set the correct priorities to make sure that you, your workers, and everyone around them are practicing safely. And as mentioned earlier too, an outbreak can last anywhere between 14 days or potentially longer, depending on cases. And responding in a timely fashion, the IPAC inspection will usually occur within that time frame of 14 days. And we are practicing under the Health Protection and Promotion Act, the Reopening Ontario Act, as well as the Emergency Management and Civil Protection Acts. And just keep in mind, though, that in a workplace that is currently under outbreak, it is a very tailored risk assessment, which means that recommendations could be elevated above what is generally recommended to make sure, again, a higher level of health and safety. An average work site visit will take about 2 hours, and that is not directly proportional to the footprint or the square footage of a workplace per se, or necessarily how many employees a workplace has, but it really is dependent on the level of engagement and the level of Q&A that is exchanged in back and forth between Peel Public Health and the workplace. Again, we're there to answer questions and make sure that there no other further clarification could be addressed. Next slide, please. So infection control, we often refer to the hierarchy of controls, and this reverse pyramid states those measures that are most effective on the top and least effective on the bottom. So on the very top there, we see elimination. Essentially, whether an infection agent, be it bacteria, virus, COVID-19, if a person has no contact with the agent, then their chance of getting an infection is close to 0. Obviously, not all of us have that luxury, and that's not always possible. So what we do a lot is that we speak to the workplace about those middle tiers, mostly about substitution, engineering controls, administrative controls, and we'll definitely speak more about those in detail in slides to come. A lot of conversation and discussion happens around PPE, the masking, eye protection, gloves, and so forth. And keep in mind, though, it is the last line of defense. So when we are consulting a workplace, it's rarely that we say that one layer or the bottom layer is sufficient for you to have adequate protection. It's always a stacked approach or a layered approach to put yourself to make sure that we put as many layers of prevention between a person and the virus to make sure that they're practicing as safe as possible. Next slide, please. So this is a snapshot of the in-house IPAC checklist that PO Region uses. It is the exact report that the workplace will be receiving at the end of the inspection, usually within several business days. And here it is also laid out in the format whereby it's resembling the hierarchy of controls, starting with what you can see there, elimination and screening. The checklist itself is also embedded with a lot of resources, again, from other public health agencies, Public Health Ontario. So if you wish to learn more about specific points being made, you're most welcome to kind of go through and educate yourself as well as your staff and provide extra training and communication as needed. Next slide, please. So let's start off with elimination, active and passive screening. So as per Ontario Regulation 364/20, it is a requirement for all workplaces to have active screening. And the essence is, of course, that we do not wish to have anyone on the workplace where they are exhibiting any signs of COVID-19. A few examples I'll speak of more directly is about temperature checks. Most active screeners at your workplace should be trained and they should understand what is the threshold for fever. From my own experience, if I've worked at a workplace and an active screener took my temperature, recorded it between 33 to 34 degrees Celsius, I was sometimes given the okay and move on. What that should be, though, is a flag that potentially there is an error, because we have to understand what the entire normal healthy body temperature range should be between 36 degrees and 37.8. If there's potentially an error with the thermometer, and maybe also due to effects of ambient temperature, the whole range is measured on the low side, you could be missing persons with mild fever. And so just knowing that, having good education, having good training, and having just the communication to know how to restrict folks and understand what you're looking for is very important. We've met a lot of hardworking folks out there in the workplaces. And one thing I want to just mention is that we've seen folks with long shifts. They've worked for sometimes 8 hours, sometimes 12 hours, sometimes even more. And during long shifts, we noticed that active screening is often done during on shifts. And keep in mind that it is a person's personal responsibility, the responsibility of their peers or management as well, to understand if they're not feeling well, to report that. And anytime during their work shift, if they're feeling unwell, it is possible to do a rescreening and again, activate any restriction thereafter. Next slide, please. So engineering controls really are the physical changes to the workplace to support disinfection, hygiene, and physical distancing. I'm sure you have workplaces have some of these measures in mind. In our favorite grocery store, we see the pylons, we see the lineups, we see the hand sanitizer placed at the entrances of most places. And on these bullets here, we name some of the most common areas of congregation and congestion: entrances, lunchrooms, locker rooms, bathrooms, and meeting rooms. But keep in mind, you know your workplace is best. There's always an area in your workplace, whether it's a smoking area, a picnic table outside, a social area, an area in the facility where it has the best air conditioning per se. You know those areas, and it's equally important for you to make sure that the physical distancing and other physical controls are there to protect areas where there's likely any kind of congregation and congestion. Next slide, please. Administrative controls work really hand to hand with your physical controls, your environmental controls. So now with the changes that's being made to the workplace, what are the different ways that people need to work with or around some of those changes? One of the first points here listed is the COVID safety plan. So hopefully your workplace has one. If this is new information to you, there's an excellent template from the Ministry of Labor where it asks you to consider, now that we're in the middle of the pandemic, what are some of the changes we need to do on some of the things we already spoke about. It will ask you to consider, in my general day-to-day operations, what are some of the changes I need to make? But they will ask you perhaps a step further and say, well, there are some occasional events that happen in my workplace. Namely, if your workplace is hiring a new group of staff and you only have a training room that's suited for 10 people, but 8 people are coming on board next week, how would you reconsider the process for training? Or further, if we're talking about rare events like a fire drill, is the evacuation plan still conducive to safely physical distancing people? Is your marshalling area outside of your workplace needs to be reconsidered? Things like that. Another important administrative control is definitely scheduling and cohorting. So we've seen many workplaces where there are multiple shifts occurring, whether that shift is a day shift or a night shift, whether that's a shift that has a break in the middle of the week, like a Monday, Wednesday, Friday shift. It is important to try to keep those cohorts separate if possible. Also, another point to think about is how would you manage overtime? Will you be using the people from the same shift? Will you be using a specific group? And how best to manage that? And some of the best examples we've seen is we extend the parameters of a cohort by shift. So if you have, let's say, A shift and a B shift, then shift A will potentially have their own lunchroom. Shift B will have their own lunchroom. And that's communicated and devised and also communicated to the whole team. Of all the workplaces we've been to, we've often heard that they've never done as much communication as they have now. And those who communicate the most, we've seen the greatest resiliency, we've seen the best cooperation in their own teams. It is ongoing. We urge everyone to have good direct communication with their joint and health and safety committees. We urge you to have direct conversations with all levels of your organization to understand what the needs and wants at all levels of the organization. And again, reach out to your local public health agency for more questions if you have any, and we're always there to help. Next slide, please. So cleaning and disinfection. One key point here is that cleaning has to occur before disinfection. So we get the question a lot whereby if I'm using this product that's approved by Health Canada, can I use it on my hands as well as to use it on my tabletop, for example? The answer is generally no, but this is where we have to advise people to read those fine labels on any product that you do. Nobody likes doing that, to read the fine print on a bottle of disinfectant, but it is actually very important. The key points I want to address is that every disinfectant will have a contact time that ranges anywhere between 1 minute to 10 minutes usually, and that has to be observed. And you have to understand whether that product is suitable for the needs, whether you're using it in between shift changes, whether you're using it for a punch clock, for example, where you need to have a quicker turnover. It has to suit the need for what it's intended for. In terms of high touch surfaces that's listed on our checklist, it's oftentimes the common areas that you would know quite often: handles, doorknobs, keyboards, light switches, and so forth. But it's also very important for you to understand, what are the unique high touch points in your own workplace. For example, in manufacturing, it could be control panels. It could be specific tools in the production line. In logistics, it could be forklifts controls, vehicles, the car keys. In emergency services, it could be potentially communication devices, medical devices, and so forth. So again, understanding where you need to be more aware. It's important to have your own checklist and have, again, the whole team involved. Next slide, please. PPE. So again, everybody knows what a mask is, and everyone knows what to do with one, hopefully, by now. As we are talking mostly about outbreaks, we are generally moving away from advising just a basic face covering, such as a bandana or scarf, but moving more towards tested PPE. And in general, we are asking for a mask that is breathable, that it has triple layers, and also it has good fits. Those are the key components of any mask. And What we're seeing more so now is that most workplaces are very compliant with the indoor masking policy, and that's great to see. Some gaps that we've been identifying more recently is how staff are managing used PPE. So are they aware that they need to be performing hand hygiene every time they need to be adjusting their mask, every time they're donning and doffing a mask, for example? The good thing is, I think we are no longer as pressured as before in terms of procuring both hand sanitizer as well as masks and face shields at this point in time. Next slide, please. So here now, I would just like to add one more lesson learned. Is the importance for workplace to have paid sick leave policies. The pandemic has really highlighted the fact that the lack of access to paid sick days is a health hazard. This especially is true for low-income workers, agency staff, contract staff, those who cannot work remotely, including those in healthcare. Many of these folks do not get paid sick days, without which they face almost an impossible decision, whether to stay home, face financial hardship, or continue to just go to work while feeling not well and infecting other people in their workplace. Given the risk of their own well-being and that these employees may face every effort should be made to protect their health and safety, as well as their families, their co-workers, and the public in general. So paid sick leave will help save lives. With this in mind, the Region of Peel launched a public campaign in January asking residents to add their voice to the call for the provincial and federal governments to provide paid sick leaves. You're most welcome to check out that link on screen. And at this time, I just want to take a minute to say thank you for all of your kind attention. I'd like to pass it back to the Mississauga Board of Trade for our Q&A session.
Well, thank you very much to all three of our presenters. It's certainly been some excellent information and some very good guidance to how people can effectively operate their workplaces. We always see, hope and pray that no workplace has a COVID outbreak that affects their employees or their customers and affects the operation of their business. But it's good to know that we've got some great people at the Region of Peel who are there and willing to help. So what I'm going to do is we'll go to the Q&A box. Just to remind folks who are watching with us today that if you do have a question for our panel, to please put it into the Q&A box at the bottom middle of your screen, and we'll try to get to as many of them as we can over the next 10 to 12 minutes before we wrap up. So let's go to what our first question was here, because I'll do them chronologically, I think. That's only fair. And any panelists will be able to jump in, and our friends from the cities or the Ministry of Labor may also decide to jump in. That's great, because the more information, the better. So question number one, if you have a COVID positive case or multiple cases, can you clarify what the law is regarding the need to keep the workplace closed? For how many days? How are these days counted? I think it was covered in the presentation, but maybe we'll do a re-wrap around again. I think we're all familiar with, and I don't expect our panelists to use specific examples, only because it was in the media. There was a decision, as an example, to shut down the Amazon facility in Brampton. That was all over the news, so it's not a surprise to anyone. So what are the rules, again, around determining whether a workplace should be closed, and what are the determining factors as to how many days a workplace may be closed if there are COVID cases? So that's probably Hyra. I think you covered that in your presentation, so maybe you want to answer that question again.
Yes, so regarding closure, again, it's not really in the law to have a workplace closed. It's based on how the outbreak is doing. And in terms of how long a workplace should be closed, it also depends on the epidemiology of the outbreak. So for instance, what's the attack rate, or what's the percentage of people in the workplace that are at risk or actually off? Sometimes it has to do with the measures, where they sufficiently implemented or they just cannot implement it. So there's many barriers sometimes for workplaces to implement some of these things. So it's not a strict 14 days from the first case. It has a lot to do with the dates of the exposure as well. So more to do with the last date that there was a case on site who was infectious. But again, it has there's a lot of considerations when a workplace closes, and in order to reopen it, it's not a specific timeline. It has to do with a lot of the actual nature of the outbreak that occurred. So with, for instance, as you mentioned, Brad, Amazon, the reopening is different from a different outbreak if they were to close as well. So unfortunately, it's not the law, and it's not actually a strict 14 days to reopen. So that is the nuances of each outbreak.
Okay, was there anyone else that wanted to jump in on that? No. Okay, so our next question. For a COVID positive case employees, do they need to get tested again to prove the test is negative before they can return to work? It seems there's, well, the questioner here is saying there seems to be some confusion. So do you need to be able to show a certified negative test to be eligible to return to work?
Ira, do you want to take that one as well too, please?
Sure. So no, they don't need a negative test. Unfortunately, if you are positive for COVID, sometimes the virus does show up in the swab for about 90 days or a little bit longer. So if you test positive, you could be testing positive again for the next 3 months, whether or not the virus is live or you're currently infectious. So that's why if you have been positive, public health just clears you based on the timeline. Normally it's about 10 days after being tested or having symptoms, but it also depends on your health condition. Some people who may be immunocompromised could have a longer clearance. But to answer the question, you do not need a negative test because you will still, unfortunately, test positive after being positive for a certain time.
Okay, and just a supplementary to that, because I think if I'm thinking it, I'm sure there's other people on the line thinking it, and I know we do have a rep from the Ministry of Labor on with us as well, because this may be an issue that would be more governed by then. Does the employer have the right to demand to receive a COVID negative test from an employee for them to be able to return to work? Is there something legally backing up an employer's right to do that?
Yeah, Brad, thanks for the question. So yeah, a requirement to actually have a worker tested is not a mandatory requirement under the Occupational Health and Safety Act. So it's, yeah, it's not, it doesn't fall within the scope of the Occupational Health and Safety Act.
Okay, good clarification, thank you. Next question is about gyms and fitness centers. I mean, they certainly have been one of the most hard hit during this pandemic as far as the amount of time they've had to be closed. The question is, will there be specific guidelines for gyms, both for indoor and outdoor activities? I'm not
So
sure.
I'll take that. I'll take that question on. So thank you, David, for the question. The requirements for opening businesses are laid out under the regulations that support the Reopening Ontario Act. And currently the region of Peel is in gray lockdown, which means that gyms cannot be open. As we move out of gray into different colors in the framework, so red, green, orange, the requirements for specific businesses like gyms, like outdoor activities are laid out in those regulations. So the regulation for the red is Ontario Regulation 26320. And so the requirements for things like contact tracing and capacity and so on would be laid out in those guidelines. There are also sector-specific guidelines that I referenced in my presentation that are available on the provincial website, and so you can go to those guidelines and find out more details for your specific business sector, including gyms. I hope that answers your question.
Louise, just to add to that, just an easy way to find the resources, because there's over 200 sector-specific resources. And I know even myself, I'm finding a hard time navigating where everything is kept. So if you go into the URL and put in ontario.ca/COVID safety, it will take you to the Ministry of Health publications, as well as all of the sector-specific guidance that's out there.
Thank you, Fiona.
Yeah. And one of the other things that I will add to that is that for whatever reason in this phase of the pandemic, the government has also been making changes within the existing color-coded framework. So sometimes you have to watch for that. I'll give you an example. Gray lockdown, in the previous version of gray lockdown, did not permit any retail, indoor retail. People couldn't go inside retail stores. The new gray lockdown allows for 25% capacity in retail. So it's not good enough to just look at gray, red, orange, etc. You've got to look and see if the government has actually changed some of the regulations and rules within each of those color categories. Red zone is another example where they've now moved it for restaurants to 50% capacity, where it used to be a maximum of 10. So we're certainly notifying our members at the Mississauga Board of Trade when these changes come out. We make sure you know those things and you understand them, but make sure you're constantly watching for your industry sector, because it's not just the change of color. It could be the regulations that change within the existing color that we're currently in. As an example for Peel, the gray lockdown one. Someone's asking about temperature checks. Are temperature checks mandatory?
I can speak a little bit to that one. So always keep in mind that temperature checks is only one symptom that you should be monitoring for. It is equally important to kind of just review the entire list. There are some sectors that's requiring temperatures. They could be residential settings, day camps, childcare centers, long-term care, hospice care. So there's a whole list. But usually we're speaking to those that have that requirement. Aside from that, it's not an absolute requirement, but it is an important part of active screening.
I know we said we weren't going to ask questions about vaccines and vaccinations, and we're not, but I am going to ask one that I think is just a macro one that's relevant for everybody, and it's probably the same as testing is concerned. Can an employer insist that vaccines are mandatory? I think I know the answer to this, but maybe the Ministry of Labor. Can you insist that an employee demonstrate they've been vaccinated?
Yeah, so thanks for that question. We get that asked a lot. It isn't mandatory vaccination is not addressed under the Occupational Health and Safety Act, but that doesn't mean that an employer can't set a policy for vaccination, but it wouldn't be something that actually falls under our umbrella.
Okay, that's good to know. Regarding determining whether an infection is acquired in the workplace, can you provide some info or examples on what to look for when determining if there is an obvious source of infection outside of the workplace?
Sure, I can answer that, Brad. So I think there were two examples that I highlighted earlier on. If there's an obvious source outside of the workplace, that could include living together and also working together. So for instance, if there is a husband and wife who live together at home and they both became positive for COVID and they so happen to work at the same place as well, it doesn't mean that these two cases with an epilink to each other is attributable to the workplace. Unfortunately, the main source of the infection was the household. So that's one example of an obvious source outside of the workplace.
Okay, anyone else on that one? Okay, do you have any ideas on how to deal with employees who refuse to use a mask citing health reasons? And if so, are there alternatives? Is there an alternative PPE that perhaps that individual could use? Who's our PPE expert?
Well, we use masking for both source control. Again, this is the point of protecting others for wearing the mask. It's also, again, if we're talking about the risk assessment, if we are talking about an outbreak setting, then of course the higher level ASTM 123 or medical mask, procedural mask, surgical mask, there are some interchangeable terms, will refer to the fact that you will be protecting yourself. So we highly recommend it for those reasons. if a person is unable to wear a mask for medical reasons or another legitimate reason, then I believe it is the workplace responsibility to make sure that they have the correct accommodations at work to make sure they can still work safely. It might have to be an increase on elevation of some of those other measures, physical distancing, allowing them to have more workforce flexibility, and so forth, to make sure that we are compensating for that accommodation.
Okay, I think we've got time for two more. How should we address employees who make poor decisions outside of the workplace, obviously violating some of the rules that might be in whatever lockdown zone they happen to be in? Can we issue warning letters for breaking those rules, or any advice for interacting with an employee that is obviously not adhering to the rules? Anyone want to take that one on? No human resource lawyers in the room.
Fiona, do you want to?
I don't know what I really don't know what you do about that. I mean, if you have an employee that is doing other things that are inappropriate, that you can tell is impacting their ability to do their job, I mean, there's protocols for that. But I don't know how you would, anyway.
Yeah.
Jump in on that?
Yeah, so I mean, it's not addressed again under the Occupational Health and Safety Act, but one of the things that we're currently focused on is the Stay Safe All Day campaign, which is staying safe both when you're at the workplace, when you're not at the workplace, when you're traveling to the workplace. So sometimes a bit of education, awareness, and promotion of that might assist with that. So there's, again, on the website that I had talked about, there's posters and everything else to try to promote the fact that things can happen outside of the workplace as well, and we want to make sure that we're staying focused all the time. But in terms of a disciplinary process, I think that would be more of an HR matter. Yeah.
Right. So the last question we're going to ask is the one that actually does come up quite a bit in the work, particularly in workplaces. What's the difference between these face shields and the mask that covers your mouth and nose? And should you wear both? Or would it depend the type of work that you're doing in a workplace? What are the recommendations for? Because I've seen people who have the face shield as well as, they're wearing a mask as well, covering their mouth and nose. I mean, I don't know, is that not necessary? Is that overkill, or is that just better protection? Or in some cases where you're concerned about the eyes as well as the mouth and nose, is that appropriate protection? So who wants to take on the face shields versus mask debate?
I can speak to it first if you want, and then maybe James wants to add something, but we're asked this question as well at the Ministry of Labor. When we're looking at what personal protective equipment is for a worker, because this is droplet spread, we're looking at ensuring that there's protection of the eyes as well as having a proper face mask. So a face shield in itself is only considered to be eye protection. It's not considered to be respiratory protection. James, did you want to add anything?
Oh, thank you for that. But I would agree that they are doing two different functions. Generally, a face shield or goggles will serve as eye protection, whereas the mask is for source control and, again, just respiratory droplets protection. So they are generally two things, different things.
Okay, well, listen, that's going to wrap up the Q&A part, and I really want to express our thanks again to our partners at the City of Mississauga, City of Brampton, Town of Caledon, to our three presenters, Louise, Hera, and James, to Fiona from the Ministry of Labor for joining us as well. This has been very insightful. I hope it's been helpful. As I said, we are recording this, and we will also do our very best with the consent of our presenters to get a copy of their PowerPoint presentations. If there's anyone that wanted a copy of that, you can contact us at the Mississauga Board of Trade, and we'll endeavor to get it to you. But there is a wealth of resources on the Region Appeals website, on the Ontario Government website. Google COVID-19, you're going to come up with all kinds of helpful stuff that you can use and implement in your workplace. So we would encourage you to do that. Just before we close, a couple of housekeeping notes and future events coming up. March 26th, tomorrow, you can join us for our town hall meeting with all 6 of our Mississauga MPPs. And we have a special guest, the Honorable Christine Elliott, the Minister of Health, is going to be joining us for part of that town hall tomorrow as well, and obviously giving us updates on what's been going on at the Ontario government level as it relates to the COVID pandemic. April 15th, we have our annual awards, virtual business awards of excellence. So please register to participate in that. This event recognizes 120 nominees in 11 categories. On April 9th, we're holding a town hall meeting with our federal members of parliament. So that is April 9th. If you're interested in issues at the federal level, please join us for that. April 22nd, our next series of the From the Corner Office event features Jeff Leger, who is the president of Shoppers Drug Mart. That should be a very interesting discussion with him in light of the role that pharmacies are now going to be playing in COVID-19. And lastly, we're all looking forward to better weather in the summer. Our annual golf classic will take place on July 12th. So mark that in your calendars now. More information to come. Good physical distancing on a golf course. It's all good. And you're outside and you can enjoy. So again, thank you everyone for joining us today. I want to thank the region of Peel Public Health Unit for asking the Board of Trade to be your host today for this event. Thank you again. Wish you a great day and a great weekend, and we wish you continued success in your business. Thanks for joining us.